We call it COVID land because it doesn't seem real.
I don't think anybody had any idea how big it was going to get.
It just seems to be way worse than a lot of the other diseases that we've had to deal with.
Patients sometimes don't make it out of the hospital. We've always experienced that, but we've never experienced it at the magnitude or the volume that we've been seeing the last 18 months.
We have loved ones who've been sick. We've been sick ourselves, but we keep coming back. That's the heart of a healthcare worker. My name's Jordan Zappetta, and I am the manager of the Infection Prevention Program at St. Vincent Healthcare. I grew up in Cascade, a small town south of Great Falls, watching my grandpa visit the hospital multiple times. I really could see how big of an impact you could make in someone's life by being a good and caring healthcare worker.
My name is Olivia Cole. I'm a ICU nurse at St. V's. I do remember sneaking down and watching ER when my parents were watching it at night. Something just about the hospital life seemed exciting to me. My dad had me volunteer at a hospital in Minneapolis when I was in high school. That kind of cemented it for me. I decided to move out to Bozeman, Montana for nursing school.
My name is Naomi Wartman, and I'm a paramedic for the flight team from St. Vincent. I kind of fell into this. There was an ad in the paper for EMTs. My husband at the time said, you should apply for that. And I did. I worked on the ambulance in Big Timber 21 years, and now I'm in the flight.
My name is Christy Poindexter, and I am with Environmental Services with St. Vincent. Well, I grew up in a little town in Montana, Geraldine. Great little place. I wanted a job that I could move around. I have way too much energy.
Michael Bush. My background is as an emergency physician. I just wrapped up a 9-year period of time where I served as the chief medical officer for both St. Vincent's and Holy Rosary. So I actually tried to get out of medical school. The first 2 years in medical school is just how much stuff can you take in and how much can you regurgitate back out. Went in and talked to the dean, and he thought things would turn around for me once we actually were interacting with patients, and he was exactly right. St. Vincent's is kind of a unique facility. We share with the Billings Clinic the largest catchment area of any hospitals in the 48 states. Billings has a very broad ability to provide very specialized care because the next biggest thing is 9 hours away in Denver, Salt Lake. Roughly, we have somewhere over 2,000 associates that work at St. Vincent. It's a huge employer for this region.
I'm Celine Maloney from Ireland and Butte, Montana, and I work at St. James Healthcare. I've been working as a clinical pharmacist here for the last 20 years.
My name's Scott Temple. I've been a respiratory therapist at St. James for 21 years.
Decided I'd come to America to try something else. I just thought that'd be nice for a jaunt, check it out. After living in San Francisco for about 7 years, up I came to Butte, Montana. Just worked out great for me. Decided to go back to pharmacy school, the U of M, and got my doctorate of pharmacy down there. And the rest is history.
My mom, she was an RN for about 30 years at Deaconess Hospital in Great Falls. She really didn't push me into the field. She just wanted me to get into a career that I could actually be a functional human being. Well, Butte is a very friendly town.
The town of Butte is rooted in immigrant traditions. You can imagine when I came here with my Irish accent and my Irish ways, it was a perfect fit for me.
My name is Luke Altenhoffen, and I'm a physician assistant at the Holy Rosary Emergency Department in Miles City. As far back as I can remember, I've always been interested in what made people sick and how they got better.
I'm Dorothy Zabraki, and I'm the mission director and head of spiritual care at Holy Rosary. I grew up in Circle, raised very Catholic. The only time you miss church is if you were dead, and I never was. felt called to do chaplaincy work. I moved away and didn't ever want to come back, and then I met Sister Bernadette Helpfer. She asked if I would consider coming back to Montana, and so that's when I made the transition from California to Montana.
Holy Rosary is sort of a mini referral center for all of eastern Montana, with great capacity to provide services to their community.
We're small, 25-bed hospital, and when people come to the hospital here, they might be coming 50 to 100 miles away from their home. It's the cowboy up part of the state. There's a gentleman, when he came in with a broken hip, he showed me how he sewed up his arm with fishing line because he had tore his arm open, and his scar looked pretty good, didn't it? And I said, yeah, it did. I said, why didn't you come in? We could have fixed that. He said, I didn't have time. Those are the things we deal with, you know.
I was raised in Miles City, went to Missoula for college. Going back to Miles City, I can't say I ever really anticipated it, but it was a breath of fresh air.
You really know the people that you're caring for, and I think that's key to what makes us who we are.
Health Flight has 2 vehicles. We have a helicopter and an airplane. We each work 2 days a week. We work 2 24-hour shifts. Patients that are very ill to be transported by air, it's a process. Holding someone's hand when they're afraid to fly, and anyone on our team will tell you I'm a good hand holder.
There's so many aspects to environmental services. We clean everything. Waste management, many hours of training involved just on the computer to go collect trash. It has purpose, it has meaning, and I love that. But I don't want to come home and clean anymore.
The lungs are just really fascinating. Respiratory therapy, you have a specific skill set. You know very thoroughly how the life support machines work, the ventilators, the BiPAPs.
The thing that's most important for me to do is to hear their story. I've been to rooms where people have said, I suppose you want to pray? And I said, not especially. Do you want me to? No. Can we just talk? Yeah, we can. There's more than just the symptom. There's what's going on in here.
I was in college when I took an epidemiology course, and I absolutely loved it. Epidemiology is really the study of disease and how it spreads. In your training for infection prevention, of course, I learned a ton about pandemics. I don't think it was a true reality in my mind until I was in the middle of it. In December of 2019, we were getting alerts from the CDC about a viral pneumonia of unknown origin occurring in China. It's not necessarily uncommon to get alerts like this.
These little outbreaks of diseases, whether it was Ebola or Zika, they kind of all sputtered out.
I was in San Diego that February. I started seeing certain people wear masks.
We didn't know enough about it to be scared of it yet. And then all of a sudden, New York got hit.
We saw the first big outbreaks in New York and on the East Coast. Washington State was one of the early ones as well. And yet we in Montana were sort of protected.
The bigger concern for us immediately was actually in about February of 2020 with supply chain issues. That personal protective equipment is a key component of how we prevent the spread of infections in the hospital.
Getting plans in place and making sure that we're at least as prepared as we can be for when it does hit us, because it, from all reports, was going to. It was only a matter of time.
That was probably the hardest moments of my career ever because of all the unknowns. The amount of time that I spent wide awake looking at the ceiling at 3 o'clock in the morning, trying to think of all the things we needed to do to help our hospital and our staff be ready.
I was kind of starting to think that maybe we would dodge a bullet because it was Montana, it was spread out, kind of far away from other things. And that was the case for a while, but it ultimately didn't end up staying that way, of course. So.
We're trying to get ready, but it's not here. And by July, it was here.
I remember hearing that we got our first COVID. The amount of people that it took to settle one patient was pretty extraordinary. 3 or 4 nurses helping you, someone on the outside of the room handing you supplies. After we got done, probably an hour later, we took our masks off and like, oh my gosh, that's a lot of work. At that point, that was our only patient. And then they started kind of gradually coming in and staying in the ICU.
Everybody was just so on edge and unsure about whether or not walking into the building we were going to get sick and whether or not our PPE was adequate.
Open the door, get everything in the room, and shut the door. Because you can't open that door again until you're done cleaning and ready to exit. Putting that isolation PPE on every room and taking it off every room.
Wearing PPE in the helicopter is very miserable. It's very hot and it's very constrictive. With a mask on, your glasses fog up. You can't see anything. That makes it very difficult.
We were learning as we went. I did these every 2-week, 30-minute updates to our medical staff at 6:45 in the morning, sharing what we know, telling people what we don't know, and what likely might come.
Some of the toughest moments that come to mind were conversations with associates who had just been exposed for whatever reason. They didn't know if they could go home. They didn't know if that was safe.
When you feel like you've been exposed and you have to now sit and wait and see if you're going to get sick.
So we knew from our projections that this was going to be something we'd never experienced before.
We have an ICU that's 11 beds. The one day I came into work, I think I'd had a couple of days off. I looked at the workload sheet, and every single room in the ICU had a ventilator. Oh my God, this thing it's the real deal.
It was exhausting. It was very go, 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 go.
I mean, you had so many people that were sick, trying to be 5 different places at the same time and prioritize, which emergency was more emergent.
When you're in the moment of it, you don't really have time to think about how crazy everything is. I think after the surge, we were like, whoa, that was a lot. I don't know how we did it.
What a gift they were to be able to care for the people, even when they weren't even sure what was going on.
We didn't really know everything about this, and we still don't, but we do know far more at this point.
The virus that causes COVID-19 is a human coronavirus. This particular one spreads much more easily.
As opposed to the previous SARS-type viruses that we had, this one proved to be the one that was both able to cause serious illness, but didn't kill everybody that got it, which the others did to a great extent. That's important as you understand how this virus was able to become a worldwide pandemic.
You end up with these pneumonias and then complications from the pneumonias. You think you're making progress, you're weaning the ventilator down, and then wham, something happens and they're back to where we started. Very frustrating, a very helpless feeling.
So much effort, hour by hour by hour. You get neck cramps just looking up at their oxygen stats on their screens, and you're just kind of tense because you don't know what's going to happen the next hour.
It's hard for somebody that isn't there to wrap their minds around. They don't see the coughing, the hacking, the gagging. And you have different severities too. Some people, they come in, they may not get all the way to a ventilator. They do well, and they just needed a little help to get there.
Seeing the good of people going home, but the bad, and just the numbers that we had to have here, it was devastating.
When the vaccines came along, it was just such a relief.
The hospital and the health department all worked together to have big vaccination clinics for the town. Middle of February, I think, in Butte, Montana, at the Civic Center, there's snow everywhere, and there's lines of traffic all lined up to get the vaccine. It was inspiring. It was great to be part of it. I loved it.
And then for all the controversies around the vaccine and how it's become politicized, that's so frustrating because we know that it's an exceptionally safe vaccine. While it doesn't prevent you necessarily from getting COVID, it certainly prevents the serious complications.
You can't even start to combat the misinformation that's out there and the misunderstandings. Some of it's not necessarily that the information's incorrect, but somebody takes it out of context and applies it to something that wouldn't scientifically make sense, but others can't see that.
The first wave in the country, came and went. In Custer County, we kind of got out relatively unscathed, but we got hit pretty hard by the second one.
The second surge really hit the rural areas even harder.
Everybody had to scramble to put plans in place and open up new areas of the hospital because COVID-19 patients were beginning to overrun the normal areas of the hospital, the ICU and the med-surg floor.
I truly did not anticipate the amount of patients that we'd be taking care of.
Some people have had to work a lot of extra shifts, and that is exhausting. There's no doubt about that.
Your shift would either run way over because everybody's just all hands on deck, or it would feel like everybody just showed up at the same time.
We never turned anybody away. If they came in with an emergency, we took care of it. Even with a surge, we don't turn people away, and I think that's what I'm so proud of.
When you're a nurse in the ICU, you are used to a certain amount of death. And that's the kind of unfortunate part about our jobs. During COVID and the height of COVID, we saw a lot of death.
Most of the time, when we'd put people on a ventilator, we anticipated having a pretty high success rate. Now, we probably lose more than we win. And it's something that we had never experienced before.
There'd be shifts where 2 or 3 people would die in the shift, and we would have to learn to do the post-mortem cares ourselves because we didn't want to expose security or the morgue to anything that could put them at risk for developing COVID.
It was so hard for families not to be with their loved ones when they were dying. And so we had to be their loved ones vicariously.
It's okay, it's why you're there, and it's the circumstances of the pandemic. But I would say that took a huge emotional toll on probably most of the unit who had to go through that with the family.
Everybody was, has been doing their best in trying to manage every facet of their care, and then seeing these people just not succeed. It's really hard to feel good about yourself and feel good about how things are turning out. So.
Staff call on me often to come and help the family get through this. There was one lady who lost a grandchild during the midst of it, and she said, "Why couldn't I go instead of him?" And I said, "I don't know why. You must need to be here to love everybody else that's missing him." But she said, "I'm ready." And I said, "Well, we're still learning from you." She said, "Get it so I can go." How do we help people die in peace? One of the things I often ask patients or the person who's dying is there any unresolved business that you need to take care of? Is there something that you're worried about? Is there something that we need to talk to your family about? And you never know what's on their mind. How do you help them just be at peace with their world? What's the memory? What's the legend you want to leave behind? And maybe the legend is I made a difference to my children. I brought them into the world and I walked with them the whole way. I don't take any of those lightly. It's really a privilege to walk with people during those times.
There's been times where, you don't want to do it anymore and you want to go home. Most of the people that have been through this understand that that's not an option. You have to keep going and see it through to the end.
That's one thing COVID did. It made us really think a lot harder about why we're doing this.
Those days that we have to give ourselves grace, we're doing hard work and it takes its toll. Having grace for ourselves, for the people we work with, really important.
More than anything, what I tried to do is remind people what a gift they were to the people they were caring. And I said, you come in and you don't know if you have one more day left in you, but I said, you still keep coming back. And that's the key to what we're about.
It's pretty common for nurses to text each other after work if they notice each other they've had a bad shift. And just to say, are you okay? We kind of act tough, at work, like nothing can break us. It's nice that our coworkers know that, okay, this is gonna probably sting, so I'm gonna check up on them tonight. So, yep.
I'm really thankful for my coworkers. They've helped me hold it together and I've helped them hold it together. We do use a lot of humor and stuff to try to get through certain parts of it.
We've all been in the trenches together, helping each other, sticking by each other, and I think that's really the key to getting through it.
Being a healthcare worker, it's definitely not for everyone. It does take a certain amount of resilience.
Healthcare workers are people who care about other people. They're willing to stay up all night, go home, get a couple hours sleep, turn around, come back and do it again.
In the end of the day, you have to be able to charge up your batteries.
It's certainly something that you have to make time for.
I have 2 dogs, Loki and Bella, both good dogs, just love them to pieces. The pure joy that they have from just going out and going on their walks, it's just fun to see. It's a great way for me to decompress and forget about work for a little bit.
I love animals. I have 2 dogs, a Yorkie, his name's Guinness, and I have a Border Collie Beagle mix, Vera. Just love coming home to those 2 at the end of the day.
I am Catholic, yes, for sure. St. Patrick's has just been my parish. I got married in that church, so I'm sentimental about it. My kids had their baptism there and their first communion and all that. It's just been a great support to me.
Wonderful to welcome a new member to our family during this COVID time. Adeline, our first grandchild. Susanna is like, give me the baby, give me the baby. I hold the baby when there's nobody else to hold the baby. Just priceless.
I have 4 kids, 9, 7, 5, and 4. My daughter is enamored with anything that has to do with a horse. Getting out there and seeing her learn and trying to learn alongside of her, that's been a lot of fun. They're a large part of what keeps me going, and I enjoy every moment I get to spend with them.
I love to sew. The one sewing machine that I sew on quite a bit is a treadle Singer. It's over 100 years old, still sews beautiful stitches. I've also made polar fleece hats. They're very simple hats, but I make them and take them to work for those horrible, cold, nasty days when we can't keep a blanket on somebody's head to keep them warm, and they go home with the patients.
I love to bake, but I don't need to eat it all, so I bake for my coworkers. It's relaxing. Great way to forget about your troubles of the day.
Oh yeah, yeah. I am 6 months pregnant. I'm very excited. It's our first grandbaby of the family. It's kind of a little tiny blessing after dealing with COVID for a year and a half. I was fortunate. I was able to get the vaccine before I got pregnant, so I don't really have to have that added worry on top of being, you know, big.
Just about everything we do can be a metaphor for something. One of the things I love to do is bake. The thing that's key to banana bread for me is the bananas have to be more than ripe. They have to be almost worthless in order to be good, because it brings out that banana flavor so much stronger. It might appear rotten, but there's something good inside. There's something good that can come out of this.
The strength of relationships that you build in a situation like this.
The team has definitely become stronger during COVID. We just had to. People really went above and beyond.
We've commiserated, we've had our rough days, but they keep their heads up, and that's a large part of the reason I keep my head up.
I've seen little new grad nurses start in COVID, and now they're warriors. They're such good nurses. They learned in the toughest conditions.
It has been really enriching for us. That sounds a little bit twisted, but it has been enriching for us to go through it, because we've come through it and haven't felt defeated.
We're 2 years into this. The hope would be that within another 2 to 3 years, we're in a more routine place. What continues to change that is the variants, and then the development of better vaccines, better treatments. Every one of those new factors introduced changes a little bit about how this is going to play out.
We all show up and put our PPE on and go forth and conquer, or try to anyway. So,
being a COVID nurse, it doesn't make you any different. You're a nurse. I'm still doing what I love, and I'm still working with people I love. I'm not a superhero. I'm just doing what I'm here for.
You see those nurses in and out of those COVID rooms every single day. They come back tomorrow and do it all over again. It's amazing. I'm just amazed.
I'm grateful for them. If I was ever sick myself, I'd love to be taken care of by them. They're a hardy bunch. Give me grief an awful lot of the time, I have to tell you that, but I do love them dearly.
we are going to get through this. It's hard to see that right now when you're right in the middle of it, but there are going to be better days ahead.
We know that life comes full circle, that we will face challenges in the future. COVID has been the challenge we have dealt with as a nation, as a world, these past 2 years, and we'll still be dealing with for a while.
I just want to thank everybody for sticking together. Keep going. Keep doing the best you can do. We'll make it through this.
Thank you. Thank you.